Hi guys, Justin here from Back In Motion Bundall. Patellofemoral pain syndrome is a common secondary problem to pain or injury to another part of the knee, such as the ligament or the meniscus. Now what we know from the research is that when you have any episode of knee pain, you'll lose activation of this inner thigh muscle here. Okay, that one's called the vastus medialis obliquus, or VMO. Now when that happens, the outer thigh muscles, they're going to need to kick in and do a little bit more work. And as a consequence, they're going to get tight. Can you see how all these muscles, they all come in and attach onto the kneecap? So if this guy's not doing its job and these guys are getting tight, what that's going to do is drag your kneecap across, and it's no longer going to track in its groove. You'll start to develop some pain on the undersurface of your kneecap. Other contributing factors to consider is your hip stability. Okay, if you don't have good stability through your hips, every time you take a step or you do squats or lunges in the gym, that hip's going to drop out to the side, which is going to put a lot more pressure on your knee. Add to that foot mechanics. If we have faulty foot mechanics, which the majority of the population does, that's going to have a knock-on effect up the chain and also put pressure on your knee. So what we need to do here in physio, in theory, is very simple. We need to strengthen the inner thigh muscle, we need to loosen the outer thigh muscles, we need to stabilise the muscles up at your hip and correct the mechanics at your feet. Now I say in theory because in practice, every time you take a step, you're aggravating it. More than any other body part, it's vital that you commit to a structured rehabilitation program, because if I was to be completely honest with you, there's unfortunately no quick fix for this sort of injury. They do take time to come good. So if you or a friend are suffering from ongoing knee pain, take advantage of our free initial assessment by calling 5592 4141 and get yourself back in motion.